the breastfeeding method. Hello, welcome to our video series on contraceptive methods. In this video, I am going to tell you about how you can use breastfeeding to prevent pregnancy for the first 6 months after birth. When you follow the guidance carefully, it is as effective as the injection or the pill. Here's how it works. When a baby suckles frequently at the breast, hormones are released in your body to prevent pregnancy. This is a short-term but very effective way to prevent pregnancy as long as your baby is less than 6 months old. He's breastfeeding day and night with no other fluids or food, and your monthly bleeding has not returned. If you only breastfeed sometimes or not at all, you can even get pregnant in the first month after birth. So, to prevent pregnancy, you need to fully breastfeed for the first 6 months of your baby's life. The good news is that breast milk is the best nutrition for all babies for the first 6 months of life. So, he'll receive all the nutrition he needs to grow and develop from breastfeeding alone. To succeed at breastfeeding, your baby should start immediately after birth. Within the first hour, most healthy newborns will instinctively move to their mother's breast and attach all on their own. This early attachment can really make a difference in establishing breastfeeding. Then, you need to feed your baby often and well whenever you see his feeding signals. When your baby is quite young, you should feed him every few hours. As he grows, you can feed him every 4 to 6 hours during the day and night. But be sure you don't give him anything else. Don't give your baby water, sweetened water, tea, honey, breast milk substitutes, or anything besides breast milk. Also, avoid using bottles or pacifiers. If you give other foods or fluids, your baby won't feed as much at the breast, and this will reduce your milk supply. They can also give your baby harmful germs and make him sick. If you need to work away from home, there are ways you can still breastfeed your baby while you are working. Many women keep their babies with them and breastfeed them throughout the day. If your workplace is nearby, you may be able to go home during the day to breastfeed. Or you may arrange to have a helper bring your baby to you. If your workplace is far away, there may be a nursery nearby where you can come to breastfeed during your working hours. Your baby needs only breast milk for the first 6 months of life. It is a common misunderstanding that babies need solid foods sooner, that breast milk alone is not enough to meet a baby's needs for that full 6 months. However, when you breastfeed your baby frequently, starting foods earlier than 6 months is not necessary and is actually not healthy for your baby. Once your baby is 6 months old, it is time to start feeding her solid foods in addition to breast milk to keep up with her growing needs. Now, breastfeeding will no longer prevent pregnancy. Think of breastfeeding as a very effective but temporary method for preventing pregnancy. Once your baby has reached 6 months, or you start giving him other food or fluids, or your monthly bleeding has returned, breastfeeding will no longer prevent pregnancy. You can even get pregnant before you begin your monthly bleeding. To be safe from pregnancy, you should choose a new contraceptive method before you reach 6 months postpartum. The mini pill, the injection, the IUD, and the implant are all safe and reliable methods you can use while you breastfeed. And the combined contraceptive pill is safe to use after 6 months. Keep these points in mind. For breastfeeding to prevent pregnancy, your baby must be less than 6 months old. You must fully breastfeed your baby. And your monthly bleeding must not have returned. Learn all you can about your contraceptive method so you feel confident and safe, and become pregnant only if and when you want to. You're worth it.